going to be using. You're not going to be using such a bag. This is how many liters? 1.52 liters, yeah? Okay. So, as it tells you, you can use it up to 1500 ml. Okay? This you can only use on a small bag. Add a small bag somewhere. Yeah. Okay? And this tells you can use from 50 to 200 ml. Yeah? Neonatal. This is, you can use it up to a 50. No, this one, sorry. This two you can use up to 1500 ml. Okay?
So once you use the humidifier, is there a role for bubbling the oxygen through fluid?
So there's still a controversy on that. These days we use dry. We don't use water in our fluid because you have this. Yeah? And sometimes what happens, it overpasses and then causes aspiration in the patient. Yeah?
Okay, I had a patient who had inflamed thyroid.
Had a what thyroid?
Inflamed thyroid gland, and upon putting the OPA, I can tell you minor, it was not even going with the animation.
It was not going through with the OPA?
Sorry?
You couldn't put an OPA because of the obstruction?
Yes.
But you can see the thyroid is much lower. So how far were you going the OPA? Because you have to be way above the epiglottis.
I think inflammation was up to a certain level that it was not even going.
It was not passing it.
So
and if you went with the NPA?
I had one.
You have your NPA. Okay, so that can be an option. Okay, let's apply for NPA. Thyroid patients, the issue is because they are so big, they're pressing on the airway. Okay? If you're in a place that you can quickly convert and use an eye gel, try and push this down. Okay? Then you can bag from that itself. It's a rescue device. There's a whole session of that. That's why you want to get to that, but you can use this as a rescue device. Okay? If not, as I said, you're never alone in the airway. When you have massive thyroid, you can always call for help. Okay. Any other question? Okay.
Maybe just to add for
for
us who work in the ED, the head tilt chin lift is mainly for non-trauma patient.
Oh, yeah.
So if you're having a traumatic patient, please don't do that. So you go for the jaw thruster. Yeah. So always remember to be patient. Your patient. Same thing that you're holding your jaw. I use this one to find the angle, and then you just lift it up. So if you're the one doing this, chances you're not going to be the one. This is where you need help. Here, chances you're not going to. So you can only maybe support the mask and keep the airway open. Someone else will need to bag for you, or someone else will need to suction for you until you can get a zip collar or something to help you, or blocks, and then you can leave your airway. This is now high trauma cases. Yeah. So if it's trauma, remember you're doing a jaw thrust. You need help as early as when you're approaching the patient, because all the other maneuvers you have to do, you need someone else to do them for you. So you don't leave there until you have stabilized your sinus spine. Okay.
You also remember that for the nasopharyngeal airway, we don't use it for the patients who have the facial fractures.
Yes.
Yes, yes, yes.
And then with the oropharyngeal, they have that reflex, then we switch to the nasopharyngeal.
Another quick, another quick way of telling if your patient has a gag, when you're doing your suctioning, as she mentioned, you can tell. So the minute immediately your patient gags, just know that's not a patient who's going to tolerate an OPA. Okay. If you're still unsure, when you're pushing the OPA directly, sometimes for patients who have an experienced trauma, because you have swollen tongue and stuff, you can use as a tongue depressor instead of your fingers if you're afraid. If you're not sure if it's an 8 GCS or a 9 or a 10, you can kind of use the tongue depressor to try. If you put your tongue depressor and the patient again tries to gag, just know, there's no need to continue pushing the OPA inside. Yeah. You need some techniques you learn here and there to manage your patients.
Any other comment, question? Feedbacks? Suggestions? Your group 1, so maybe there's something you need to remove or add. Sawa, sawa.
So we are all comfortable.
Yes?
For a baby.
Yes.
We shall come for another one.
Yeah. There's a whole neonatal one, pediatric. I think that's the afternoon. Yeah.